Dissatisfaction with how President Obama is handling the Ukraine situation, as well as worries over the economy and health care, have led to his lowest approval rating yet in one major survey. Just 41% of those taking part in an ABC News Washington Post poll approve of the president's performance. Only 37% are on board with his health care law. Chief National Correspondent Jim Engel tells us it's all about the money.
New polls continue to show the public skeptical about the impact of Obamacare, especially on cost, something analysts have long warned about.
The new Obamacare policies cost about 35% more. That increase can come in the form of higher premiums, higher deductibles, or narrower networks.
And in the latest Washington Post poll, consumers agree, with 58% saying the new law is causing higher costs, while only 11% say it's reducing them. That meshes with a new Kaiser poll that found the most common reason for remaining uninsured is not being able to find an affordable plan.
They may be better off if they can get a subsidy, but the underlying costs are higher, and they're going to be even higher next year.
Cost may also be one of the reasons the law remains unpopular. In the Washington Post poll, 48% oppose the law, 44% approve. A Kaiser poll shows an even broader gap between unfavorable and favorable views. Another reason for opposition is unhappiness over limited access to doctors and hospitals.
Insurers kept the price tag down by saying you can't go see any doctor you want, you can't see any hospital you want. You can go to the ones where we cut a very good deal. And that keeps premiums down to begin with.
But consumers often didn't know which providers were included when they selected a plan. Mike Kreidler, the Democratic Insurance Commissioner in Washington State, just issued rules requiring more clarity about which providers are in the state networks. He also imposed more standards than found in Obamacare itself, as he required all health plans to, quote, have an adequate number of medical providers and that they provide access to care in a timely manner and within reasonable proximity. Long waits and long drives are both common and unpopular, but new standards would make Obamacare even more expensive.
If you force insurance companies to have broader networks, the only way you get it broader is you raise the fee you're going to pay to the doctors. That means the premium will go up as well.
Though President Obama continues to argue his signature health law is lowering costs, patients obviously believe otherwise, and by huge margins. Shannon?
Thanks, Jim.